We are now on to week 4 and we are continuing our discourse on module 2 as we continue looking at high incidence special needs. This week the objectives are first to understand that special educators work in inclusive settings serving a range of special needs categories. We'll be taking a look at emotional and behavioral disorders, attention deficit hyperactivity disorder, health impairments, as well as looking again at some accommodations and modifications that can be provided. Now, emotional and behavioral disorders is a fairly popular disability category. There are many different types, as you can see in the illustration that I have here. But in order for an emotional behavioral disorder, for short EBD, for it to be identified, there must be behavioral and emotional responses that adversely affect educational performance. So, what are the red flags? Well, as a classroom teacher, you're going to notice an inability to learn that exists that cannot be explained by factors relating to health or IQ or sensory problems. You're also going to notice poor interpersonal behaviors and a pervasive mood of either depression or unhappiness might also be present. Additionally, the condition includes a tendency to develop physical symptoms of fear. Whenever you're seeing any of these, or even if they are in combination, then that might indicate that a child has some sort of emotional or behavioral challenge. There are two broad types or dimensions of disordered behavior, and they can be externalizing or internalizing. Externalizing behaviors are those that consist of disruptive, hyperactive, and aggressive behavior. So it might be related to alcohol use, drug use, some sort of conduct disorder, or even antisocial behavior can be externalizing. And internalizing behaviors are those that are negative and problematic, but that are directed inwardly. So anything related to distress or fear like depression and social phobias and panic disorders and so on, those would be considered internalizing. We would have touched on comorbidity previously, and it simply means that where you have two or more conditions occurring together. So a student might be both internalizing and externalizing, or an emotional behavioral disorder might exist with one of the categories that we spoke about before, for example, a learning disability or a physical impairment. Then when you have that occurrence, that is referred to as comorbidity. So what are the characteristics of emotional behavioral disorders? Well, social skills, poor social relationships, inability to cope effectively, and so on. Delinquency, and this is a major issue here in schools in the Caribbean, where students are encountering difficulty with the law. Students may also be exhibiting behaviors such as tantrums or non-compliance with the rules, aggression. All of those are red flags to look out for with emotional behavioral disorders. There are many different causes of EBDs, such as biological disorders and diseases, pathological family relationships, undesirable experiences at school, as well as negative cultural influences. And so when we talk about intervention for a person with a diagnosis of EBD, those causes, which would be the root, would also have to be addressed. Additionally, in the classroom, successful teaching and learning outcomes can be achieved when teachers are equipped with the understanding that in spite of the fact that a student has an EBD label. The student can be bright, creative, energetic, and fun to be around, and can definitely master important academic and social skills. So, as an educator in the classroom, you would want that your intervention would relate to personal interaction, self-management skills, as well as your own classroom management skills in terms of how you will be modeling behaviors for your students and how you will be enforcing consequences. Those also need to be intact. Let's take a look now at another high incidence category, attention deficit hyperactivity disorder. Now, under IDEA, ADHD is under the category of other health impairments. However, this is one of the most heavily researched childhood disorders, and so many persons refer to students when they realize that they're not paying attention in the classroom, they can't sit still, they can't behave. It's very common for them to say that a student has ADHD. What then is ADHD? Well, the APA defines it as a persistent pattern of frequent and severe inattentive or hyperactive impulsive behavior. The behaviors must occur in more than one setting for a diagnosis of ADHD to be given. So it can't be that a child is just misbehaving at school only, or it can't be that a child is just misbehaving when they go to a specific place, but the behaviors must occur in more than one setting, and they must impair social, academic, or occupational functioning in order for ADHD to be considered. There are three main types of ADHD. A student may be primarily inattentive, and that's one type. He or she can either be hyperactive impulsive, which is another type, or the student can have a combination of both. So what are the characteristics or the signs to look out for? In terms of impulsivity, you would see that a student experiences difficulty waiting for his or her turn, or has trouble waiting until a question is finished before answering, or that student might often interrupt others. All of those characteristics relate to impulsivity. Inattention has to do with being easily distracted, having trouble following rules and finishing tasks. Any student with organizational problems, the student who might be losing things often, forgetting to do activities given, daydreaming in class, those relate to inattention. And hyperactivity relates to a student who might be squirming or fidgeting when sitting. That student just can't sit still, can't remain in the seat, has trouble playing quietly, is very restless. And students who may be talking excessively. Those characteristics relate to hyperactivity. Now, the causes of ADHD are not known, but researchers believe that conditions can arise from different sources, such as brain injury, either trauma or infection. There can be a genetic link, and other risk factors relate to prenatal use of alcohol and tobacco. However, there is a growing consensus that ADHD has a neurological basis. So the researchers have concluded that it has something to do with the brain. In terms of the classroom application, classroom teachers would need to be very, very patient with students with ADHD. Now, although medication is prescribed for the majority of students within this who have this disability label, there are some instances where the medication alone will not be sufficient. And so the classroom teacher would have to teach skills now relating to self-management. The classroom teacher would have to have proper classroom management strategies in place. The student will have to be taught how to set goals for him or herself, and how to self-regulate. The third and final disability category that we're going to be looking at with high incidence disabilities is physical and health impairment. Now, a physical impairment, also referred to as an orthopedic impairment, includes impairments that may be caused by congenital anomaly, disease, or other causes such as cerebral palsy and amputations. It relates to problems with the structure or the functioning of the body. Special healthcare needs or other health impairments are those that relate to disease or chronic illness. So they would result in a person or the student having limited strength, chronic or acute health problems, and obviously those would affect educational performance. Under physical disabilities, a person can have either neuromotor impairment or muscular skeletal condition. And the causes are varied. Some causes can relate to allergies, others accidents and injuries. Some health impairments can be hereditary. And in order for prevention to occur, things like good hygiene, immunization, avoiding injuries, all of those can assist in that regard. Now, under physical disabilities, some of those that you might have heard about before would be cerebral palsy, amputation. So if a person loses a limb, juvenile arthritis, spina bifida, muscular dystrophy. All of those are physical disabilities. And other health impairments under that category, some of the labels would be things like epilepsy, Tourette syndrome, asthma, HIV and AIDS, cancer. And it's important to note, teachers, that even students with health impairments, they have to be provided with the appropriate accommodations and modifications to meet their needs. I want you to take a look at some of these pictures. They show some of the common disabilities that I've just listed. So cerebral palsy, paralysis of the brain, spina bifida has to do with bones of the spinal column being not closed up, and hydrocephalus has to do with the fluid in the brain now, which results in an enlarged head. Spinal cord injury, and all of these are physical impairments. It's a break or severe bruise to the spinal cord. Muscular dystrophy has to do with a deterioration of muscles. Arthritis has to do with an inflammation of the joints. And well, the number of other health impairments that there are, which would be too many to mention, I would not be able to go through with you. However, I would want to share with you this specific procedure, which is this for dealing with a seizure. And in the event that a seizure ever occurs in your classroom, this is what you need to do. Make sure that you don't put anything in the student's mouth. Don't hold down the child, but make sure you time it. You turn the student to the side, loosen tight clothing, and cushion the head. This is where I would leave you for today. I encourage you to read the lecture notes as well as get involved in the discussion.